So I have complex regional pain syndrome, and what that is I get burning pain up and down in my legs because I sprained both my ankles playing football, and then I also had the RSD or complex regional pain syndrome going to my left shoulder, chest, and just down my arm because I had someone pull a chair from behind me and I broke my fall with my shoulder. And since then I've had discoloration, I've had excessive perspiration, I've had the burning, searing pain throughout my body, and we've tried multiple things. We've tried nerve blocks, we've tried physical therapy, I've even done ketamine infusions, which have been proved to be very helpful for me. But it's just been, we haven't found a lot of success with these treatments, and I've also had associated with these things migraines, something called cramped fasciculation syndrome, where my muscles are just very overactive and fasciculating a lot. I've had urinary retention, just a different array of different things going on, and it's proved to be very difficult to deal with. You know, these things are just saying that hey, we're here, we're going to make your life miserable. So there have been a number of things that we've tried, and just combating against them all, but at the same time trying to treat something has just been very difficult. We've tried some even drugs. Drugs we tried for these things. Currently I'm drugs for my migraines and my cramped fasciculation syndrome, and even though I might get the benefit from the drug, I also get the side effects. And the side effects are sometimes really hard to deal with, even with the CRPS. We tried drugs for that too, and the side effects just weren't worth it, being on the medication of the drugs. So I would, just try to, push through it and get through it that way. So these things that.
What are some of your symptoms that you've had in your head, neck, jaw area?
So I've had vertigo. I've had headaches, pain in my jaw. I've had popping in my jaw. That's been pretty much it. I mean, the headaches have been the migraines have been really difficult to deal with.
How long have you had the migraines, and how often?
I've noticed the migraines. First time I noticed the migraines was in May 2009. And at that time I was in a physical rehab program, and I remember coming back from my activities and just having to go to my room and turn off the lights, lay down. And at that time it was every once in a while, but as the years progressed to the point now, I now have chronic migraines, where they're there all the time, practically all the time, hour by hour, and they're very debilitating. They cause nausea, dizziness, and functioning is very difficult.
Okay. And what's your pain level right now as you're sitting there?
Currently my pain level right now is 7. It's in both legs. It's in my left arm, it's in the back of my neck, and I do have a headache as well.
Okay. Now you have been here and I fine-tuned and adjusted your mouthpiece. I'm going to let you take it. Tell me what you feel as you put that mouthpiece in, and what changes you feel.
It's really cool because I feel this rush. It's kind of like a waterfall that starts at my neck and then just goes down my entire body. It's like this cool sensation that goes to my legs, goes into my arm, and it's almost like a euphoria feeling. I almost feel kind of a little bit lightheaded. And the pain in my legs is gone. My left arm is gone. It's like a freedom. It is like freedom. My headache's gone down a lot. It feels better with the mouthpiece, and that's for sure. It feels a lot better. It feels so good. It's just this relaxed feeling. And I haven't been in this state for quite some time. Just feeling absolutely relaxed. And it's like this tranquility. It's like I finally found peace with my body and everything else. I mean, it feels good. Wow. It's like I can breathe, I'm not so tense or stressed. It's just, it feels really nice.
So what I want you to do is bite down on your back teeth. There's nothing in your mouth right now. I'm going to put some pressure. I want you to resist. Okay, resist. Ready? Okay, one more time. Now I'm going to do it this way. Here we go. Resist. Good. One more time. Resist. Good. Resist.
Oh, okay.
Good.
So I never, okay.
Shivers.
You're feeling shivers?
Oh yeah. I mean, I had a hard time resisting you. Okay.
Here's the mouthpiece. Light tap, 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 tap.
So far.
Good. Close your lips, relax on that. Give me your arms. Let's go this way first. Ready? Resist. This way. Resist. See, one more time. Ready? Resist. What are you feeling?
I definitely don't feel like I'm gonna collapse like I did the other time. I didn't feel like stress. It was like painful when you're pressing down before too. This time it's like I was locked.
Now
do
you
it.
feel. Ready? One more time. Resist. I'm putting my whole weight on you. And you're bouncing back. Good. That's it.
That's awesome. I can start working out now. That's cool.
Okay, this is our 2-day follow-up. Give us an update of what you felt since you've had the mouthpiece for the last 2 days.
So since I've had the mouth the last 2 days, I've noticed a significant reduction in my pain in my left shoulder, as well as a very significant reduction in my migraine headaches. I used to get them very consistently and for a long period of time. And since having the mouthpiece, I noticed that although migraines may still be present with activity, as soon as I'm able to calm down, the migraines actually dissipate, which was very new to me because usually they'd stay in prolonged states. I noticed I've been sleeping a lot better too. I've been dreaming. That's been pretty big for me too. I've also noticed something with my speech. I haven't been stammering quite as much. I feel more confident speaking. I've got a mouth cord in my mouth that makes it hard to talk, but just speaking to my words out. That was a big change that I noticed and I was really satisfied with as well. So I've definitely noticed a very significant impact with pain and with some of these other things I've been dealing with. So I'm really happy with that.
Overall CRPS with the mouthpiece in?
Pain is a very limited amount, very limited intensity. So in my arm I feel it's no longer there, pretty much my arm for most of the time. And in my legs as well as my lower back, but I can notice it significantly in my left arm.
All right, good. Thank you.